Welcome to Sound Bites, hosted by registered dietitian nutritionist Melissa Joy Dobbins.
Hey everybody, welcome back to the Sound Bites podcast. Did you know osteoporosis accounts for more days in the hospital than other diseases like breast cancer, heart attacks, diabetes, and more? And approximately 1 in 3 women and 1 in 5 men over the age of 50 will break a bone due to osteoporosis. Now, I have a family history of osteoporosis, and I'm sharing some stories about that with you in today's episode. And I'm really grateful that I grew up doing weight-bearing exercise every day with my ballet classes and drinking milk. And then I started lifting weights in college, and I'm still lifting weights today. But I know as I go through perimenopause and menopause, I'm at a greater risk for bone loss. So, everybody knows that calcium is good for your bones. But did you know that prunes can help your bones? Well, I didn't. But I've got some interesting information in today's episode, so stay tuned. We're going to talk about some research that my guest, Dr. Shirin Hooshmand, is doing. Now, this episode is sponsored by Sunsweet Growers, so I want to tell you a little bit about them. Sunsweet Growers is a grower-owned prune cooperative based in Yuba City, California. Sunsweet strives to help make it easy for consumers to make healthy choices by offering a full range of delicious dried fruit and juices. So the Sunsweet Amazing Prunes and Prune Juice are favorites around the world and in my household, and they provide the nutrition you need to keep your body feeling good and energized. So you can visit their website at sunsweet.com. It's a really great website. They've got some awesome resources. There's a healthy living hub and a healthy living learning center with some downloadable materials. Of course, there's recipes, and you can also follow them on social media on Facebook, Twitter, Instagram, and Pinterest. You'll find them at Sunsweet or at Sunsweet Growers. And I hope that you enjoy today's episode and learn a lot about prunes and bone health, and also with a side of digestive health as well. So enjoy the show. Hello, and welcome back to the Sound Bites podcast. I'm your host, Melissa Joy Dobbins, a registered dietitian and nutritionist. And on this show, I delve into the science, the psychology, and the strategies behind good food and nutrition. And today's episode is all about bone health and digestive health at every age. Now, my guest today is Dr. Shirin Hooshmand. She's an associate professor of nutrition at the School of Exercise and Nutritional Sciences at San Diego State University. Welcome to the show, Dr. Hooshmand.
Hi, Melissa. It's a pleasure and honor to be here and speaking with you.
Yeah, I'm really interested in your research on bone health and the findings that you've also seen with digestive health. But let's start with your background. How did you become interested in nutrition, and maybe a little bit about where you went to school and some of your work? And I understand that you recently became a registered dietitian.
That is true. So I really became interested in nutrition from one of the first nutrition classes I took. So I know a lot of people have really interesting stories about how they started in the field of nutrition. I always feel mine is kind of boring. I just was like, I went to this class and I was in love with nutrition, and I just wanted to know more and more in this area. And of course, doing research in undergrad really helped me to understand the field a lot better. So that's what I always encourage my, undergrad students to get even a little bit, if it's possible, to get involved in research and see what's going on. So it makes them better understanding of the field, and it may help them to have a bigger love for the field of nutrition. So I got my degree in the US from Florida State University. I'm originally from Iran, so I received my undergrad degree back home. And then I came to US for graduate education. I graduated from Department of Nutrition, Food and Exercise Sciences at Florida State University. And mostly I've been educated in terms of, or trained basically mostly in terms of bone health and nutrition. I continued with the same field during postdoc, and when I got my job at San Diego State University, most of my studies have been focused on bone health and nutrition.
Excellent. Well, I think a lot of dietitians can relate to that first nutrition course sort of piquing their interest. They weren't majoring in it, but they took that class, and I think that happens more than you would think. So not boring. I think it's pretty cool.
I'm glad.
And you work with many different companies. I'd like you to share a little bit about that. And this episode is sponsored by Sunsweet Growers. So we are very grateful for the sponsorship. I know that you work with them, but you also work with other companies.
So I am a research consultant for Sunsweet, and most of my research focuses on different fruits, really. So my funding comes from different fruit boards, if we call them fruit boards. And so I receive funding for research from California Dried Plum Board, American Pistachio Growers, California Strawberry Commission, National Mango Board, National Watermelon Promotion Board. So those are namely at least my current funding. That's where it's coming from.
Okay, great. A lot of times I'll ask researchers on my show to maybe speak a little bit to this type of industry-funded research and the importance of it. And I don't want to put words in your mouth, but I love to hear the different personal explanations of why it's so important to have this type of research funded.
Sure. So majority of my research and a lot of colleagues that we collaborate together on this kind of research, we focus on whole food, basically. We work on fruit as the whole package. Like if we talk about dried plum or prune, it's just the whole fruit. We don't try to extract or have components. So when the research mostly focuses on the whole food, the food boards become much more interested in funding this kind of research compared, like, let's say, to NIH, or still USDA is good because they are also interested in whole food. And, we still get funding from USDA and American Heart Association. But complementing those kind of funding from food boards is something that we always have been interested in. We have been following up on the funding and RFAs that they put out, and we all apply. So I don't know how your audience, how much they're aware of the funding opportunities, but these are basically RFAs that different food companies put out there, and they look for different proposals that different researchers from all across the United States in different institutions, they apply for these fundings, and then they would pick. They have usually scientific review boards and committees that they review these kind of proposals, and they make decisions based on what's most sound science to be feasible and to be able to be conducted in the limited time that they are interested in. And so I've been funded by different food companies. I think most important for that is just to make sure the scientists are always disclosing their funding sources and are also ethical in conducting the research.
Mm-hmm. Right. And we know that funded research tends to be higher quality than research that's not funded. And we know that NIH doesn't have the funds to fund everything. So clearly it makes sense for food companies to have an interest in that and a responsibility for that as well. So thank you for sharing that. So your research on bone health is of great interest to me. So let's start with that. I have some osteoporosis statistics and also a few personal stories to share along the way. But where would you like to start with that discussion?
I'm interested to listening to the statistics. It's, osteoporosis and bone loss is really close to my heart because that's what I've been dealing with, doing research with patients who are suffering from that for the last 15 years. So please go ahead and start with the statistics.
Okay, great. Well, I have some of these in front of me, so I'm going to read some of them. It always surprises me, coming from a clinical background, that bone health, or I should say bone disease, is so prevalent, yet it just doesn't seem to get the attention that it deserves. We tend to focus more on cancer, breast cancer, heart disease, but bone health is right up there when it comes to overall health and longevity, morbidity, mortality. So an osteoporotic fracture occurs every 3 seconds worldwide. And approximately 1 in 3 women and 1 in 5 men over the age of 50 will break a bone due to osteoporosis. And I think there's just not so much awareness of how prevalent it is. And people might be thinking about it later on in life. I used to work for the Dairy Council, and we used to say that osteoporosis is a pediatric disease with geriatric consequences. And it is something that we need to pay attention to when we're younger and not wait until later. And I know that you're going to talk a lot about that as well. And I have some stories that I'll share as we go along as well.
Sure. So as you perfectly explained it, this is a disease that even though we majority of the time associate that with aging population or older patients, but that's really something that you have to start taking care of your bone really as early as infancy. As the person is born, you are responsible for proper nutrient in terms of feeding the infant and then reaching the peak bone mass. That is what we are trying to get to, the highest peak bone mass. And of course, after that, maintaining that bone density throughout years. So it's a lifetime commitment and work to make sure that we have healthy bones. But of course, nobody talks about osteoporosis because bone loss is really a silent disease. Usually nobody knows they're suffering from osteoporosis until a fracture happens. So fracture usually considered as one of the first symptoms of osteoporosis. And by that time, it's usually too late. It's usually we know the person has osteoporosis and it's become much more difficult to deal with the condition versus if we are aware of the condition and we just prepare all our life to have better bone density and maintaining that bone density with better lifestyle choices, being nutrition and exercise or the combination of both.
Mm-hmm, right. So approximately half of our bone mass is accumulated during adolescence, and we start losing bone around the age of 40. And then as we've been talking, if we have this bone loss that can lead to falls, sometimes it's like, which happened first, the chicken or the egg? Did the fracture cause the fall or did the fall cause the fracture?
Yeah. So it's just really what happens after fracture, especially the morbidity that's related with number of fractures that we have. So nowadays we put so much emphasis also in the fracture risk, and really that become really important for patients, especially in older years. Because as we are younger, still we have fractures, but we heal. We still are able to heal and deal with the situation. But as we get older and bone loss is more serious, then the fracture causes much more problem because of the morbidity and mortality related to that.
Yeah, I'm glad you brought that up because that is something that we think of most often with the elderly. Once you've broken a hip or you have a fracture, the quality of life can really plummet. But it can happen to younger, older adults, if that's the way to say that. My grandmother had osteoporosis, and I remember one story in particular is that she had gone out to get the mail, and I believe she slipped and fell on the ice and broke her hip. And she had to drag herself back into the house and then pull herself up the wall to get the phone that was on the wall, because this is prior to cell phones. And how she had the strength and the stamina and with all that pain to do that. She's one tough cookie, I'll tell you. But fast forward to a few years ago, my mother, so I just recently turned 50 and my mother is 20 years older than me. She's a very young 71-year-old. But a few years ago, she fell in the garage, and it was a strange situation. And maybe we can talk about fall risk a little bit, but that might be beyond the scope of this. She reached up to grab something off the top shelf. Well, actually, it was salt. It was the day before Christmas Eve. And she went to grab the container of salt to put it outside so that she wouldn't slip and fall. And I think the container must have been open prior to that because it had absorbed a lot of moisture. It was a lot heavier than she expected it to be. So when she picked it up, it kind of threw her off her balance and it brought her down into like a squatting position. And she was fine until she just sort of plop fell over. And then she couldn't get up. She couldn't move. But she had her cell phone on her, and she had one of those 911 apps that has all your medical history in it and everything. So PSA to everybody listening, please make sure you have that and all your loved ones have that, because she lived alone and I was 3 hours away. And ironically, we had just texted back and forth good night. And I woke up the next morning to like 30 text messages from her saying, I've fallen and I can't get up. I called the ambulance. I'm on my way to the hospital. I'm going into surgery, all of that. And so it really, even though she was only about 66 at the time, it really has changed her life. I mean, she's doing well now, but everything that went into the surgery and the recovery and the rehab, she lost a lot of weight. She, of course, is losing bone mass at the time. But yeah, so it can be really life-changing.
That is true. And just exactly as you explained, we usually say, well, it's the National Osteoporosis Foundation statistics that shows that after every fracture, especially the hip fracture, 25% of people after hip fracture usually die within the following year. And another 25%, they have to move to nursing home and never return home, and the other 50%, usually they regain their function, but is never as perfect as it was before. So really, we want to take care of our bone, even though, a lot of time, I teach at university and the population I work with are very young. So I constantly talk about osteoporosis and I have lectures on this in my classes, but I can tell that they are much more interested in obesity topic when I talk about that versus when I talk about osteoporosis. And I try to explain that this is something that you need to be careful and be ready for that now that you're young, versus waiting for when we deal with these statistics that I was talking about.
Right. Prevention is huge. And I should say, especially in case my mother listens to this episode, that she will be quick to correct me that she didn't break her hip. She broke her leg, her femur, but it was very close to the top, but she had hip surgery. And yes, we were grateful that she was as young and healthy as she was because the rehab was intense and, she kind of lives in fear of falling. And I do think it has decreased her mobility. But Mom, if you're listening, you're doing great. You're a very young 71-year-old. So Shirin, let's talk about your research on bone health. I know that you have a recent study that came out in the Journal of Osteoporosis International, I believe.
Yes.
And it dealt with dried plum and bone density. So tell us, let's get into the science. Tell us why you decided to study that and what you found.
I'll start with the whole story of why prune, and why did we choose to study prune or dried plum in terms of bone. So the recent study that you're talking about is one of the recently finished study, but we have done several studies in this area. So the most recent one is when we were comparing 2 different doses of the prune or dried plum daily to see if lower dose could be as effective as higher dose. So originally we did a study with 100 grams. That's 10 to 12 prunes per day in osteopenic postmenopausal women. And they consumed this daily, every day for 1 year. And there was a control group in the study that our participants got compared to the control group. And all of these participants were osteopenic, as I said. So we confirmed with the DEXA measurement that they have osteopenia, and then they were allowed to be in the study. So after a year, what we find out was that 100 grams was able to prevent bone loss in these postmenopausal osteopenic women. And so this was amazing, exciting. The bone density changed, the bone biomarker changed, but we were hearing a lot from our participants that would be so much more feasible if we could go with lower dose and see the same effect. So we decided to conduct another study, and then this time we compared 3 groups. They were 0 gram, they were just receiving calcium and vitamin D supplements. The second group was receiving calcium and vitamin D, but 50 grams of prune, which was, 5 to 6 prunes per day. And the last group was receiving calcium vitamin D supplement, but then 100 grams of prune. And what we saw was that, again, these postmenopausal osteopenic women, they showed that 50 grams of prune is as effective as 100 grams in terms of preventing bone loss.
That's great news because we know if something's good for us, but it's maybe not, like you said, feasible. It's not something that people can do on a daily basis or a weekly basis and kind of keep up with. We want to make the healthy choice, the easy choice. Mm-hmm. And you mentioned prunes and dried plums. And so just clarifying for anybody who doesn't know, they're the same thing. Not sure why there's different names.
I'll tell you why there are
Awesome.
different names. So I think the board changed the name in 1998 from prunes to dried plums, just to make it more likable by younger population, because we always associate prunes, by just maybe it's digestive health and just dealing with elderly population, rather than this wasn't something that, younger people liked it. So dried plum gave it a new face. But now Actually, I think they're back to calling it prunes, and they are very proud of its property and its name. And so I guess they go with both names.
Excellent. Thank you. I kind of thought that might have been the rationale, but I appreciate you sharing that. Could you also explain for our listeners the difference between osteopenia and osteoporosis?
Sure. So osteopenia is the step before osteoporosis. So World Health Organization has definition on bone density T-score. So basically, when we do DEXA measurements, we can measure the bone density. And based on that, the density gets compared to a 20 years old healthy bone density. And we will be assigned a T-score by equipment as we go through the scan. Based on the T-score, World Health Organization will define that we are having normal bone density or we are starting to be in the osteopenia area. That's, low bone density. And then when we really go lower on the T-score, then we start to be in osteoporosis, the stage of bone loss. So based on the recommendation, when the patient is in osteoporosis area, then they should be referred to physician. We usually don't do nutrition study in osteoporosis population, because those are the population that definitely they are receiving the medication, but we deal with osteopenia mostly, and that's lower bone density. So we try to help them maintain the bone density or at least improve it, or, so that's the population that we do most of our bone studies on.
That makes a lot of sense. With regard to prunes and dried plums, like you said earlier, we kind of associate that with, we know that it's good for digestion. We know it helps with constipation and bowel movement. Gut health is very important, so this is key. But why is it good for bone health? What is it about the prunes that makes it good for bones?
Prune contains really several nutrients that is important for bone. So I know we all have heard all our lives that calcium is important for our bone and vitamin D is important. And of course, that's the base, and we need to have that for a healthy bone system in our body. And in all the studies, all the human studies we have done, we always supplement our participants with calcium and vitamin D. So we make sure they get enough calcium, vitamin D from their diet. And if it's not enough, then they receive the remaining from supplements. So that's the base. But then there are other nutrients that are important for bone. So we have vitamin K, magnesium, potassium, boron, copper. All of these different nutrients that they all play a role in bone, they are combined in prunes or dried plums. So it's just really a good mixture of these different nutrients that each play a really important role for bone. So for example, when we talk about 100 grams, which is 10 to 12 prunes, that's kind of give us our half of our requirement for vitamin K. So, you might really not think about that, but receiving just half of your vitamin K that we know is really important for our bone from that nutrient is really important. We know it's a good source of potassium. 100 grams of prune gives us like all our requirement for boron. That's another important nutrient for bones. So it's just also high in antioxidant, and it's really have different polyphenols that we know they are important for bone health. And why I say some of this we know is we don't know them much through human studies. Hopefully there are ongoing human studies that we would know more and more about the mechanism of dried plum or prune in terms of bone. But along with these human studies, there are plenty of published studies from our lab and from different institutions at US that they are working in this prune and bone health in different animal studies and cell culture studies, trying to really extract everything from prune and see which one is responsible. Or when we talk about polyphenols, is it a single polyphenol that's important, or is it a combination of that? So there is ongoing research in this area trying to find out, because we are all fascinated by how prune is really helping with bone loss. And so we are really very interested to find out the mechanism. So far, I can tell you by research, we know it's not really one component of the prune that's playing this role. It's the combination. So that's why it's really a perfect kind of like whole research, because everything together is helping to have this bone protective effect.
That synergy. Mm-hmm. And some of your research was done on women, but those results have been replicated in men. Can you speak to that a little bit? Because we do tend to think of women, but it affects men as well.
So we have always focused on women, and especially till 5-6 years ago, the whole emphasis of osteoporosis was always in women. And we understand that because for women, the bone loss starts when menopause starts, and that's like really bigger portion of our life, So we hit 50, 55, and then the bone loss starts because of lack of estrogen or lower estrogen level. And then for men, it happens a little bit later in their life. So they have another, 10 years. And so the focus of even the funding agencies wasn't much on men and osteoporosis. But I feel like we ignored them because osteoporosis happen in men as well. And we have to, pay attention to their bone loss and care about them. So we conducted one of the first men and osteoporosis study in terms of nutrition and prune. And we have just completed the study, so I don't have the results and, I don't have everything completed, so I can't share every detail of the study yet. But I can tell you that, it was the similar design, and we had men in control group, which they were receiving calcium and vitamin D pills, and our treatment group was calcium, vitamin D, and prunes. And so we had everyone in the study for 12 months, and we just finished the study. So hopefully soon we will have the result out and published and see, how it affects. But our preliminary results, which seems like be promising, and hopefully the same for what we are seeing. But in animal studies, prune has been in both male and female animal models and has been very similar. So there have been, like before any of these human studies, there have been plenty of animal studies comparing male animal model, female animal model, aging, or even young. So we have seen prune working in all of them. Doesn't matter. It's the lack of sex hormones, or is it the lack of just aging that's causing that, or just even in younger animal studies, the peak bone density increase as a result of prune consumption in animals. So at least we know as far as animal studies, all of them are showing very much a positive effect.
Very good. Let's talk a little bit again about osteopenia and bone scans or screenings. I mentioned I just turned 50, and that's when my doctor suggested my first bone scan, which thank goodness was normal. Is that a typical age that somebody would do a scan like that?
I think based on the healthcare system, that's, a normal age, and that's basically better than nothing. But if the possibility exists and people have access to DEXA measurements, I always encourage that even younger population should know what's their bone density so they can do something about it. But that's about the age that at least we should start looking for our bone. Mm-hmm. But we know like really big proportion of our population go untested in their bone density. So there are like a really large number. The statistics is like 2 million broken bone per year. And 84% of older Americans who suffer from these bone breaks are not tested or treated for osteoporosis. So we really have a big population that are not getting regularly tested for their bone density.
Mm-hmm, right. And obviously early detection and more proactive treatment, if you will, diet and exercise to begin with, can help delay the progression of that bone loss. One of my colleagues who's actually been on the podcast 3 times, her name is Lauren Harris Pincus. She was attending our annual conference, Fancy, and she went to the SunSuite booth and got a bone scan. And I think they were doing the hand scan at that time. And they said, "Oh, your numbers aren't looking very good. You should follow up with your physician," which she did. And she was in her early 40s at the time, and she was diagnosed with osteopenia. And she wouldn't have known. And, you can imagine then waiting 10 more years to have that first scan. She obviously took a more proactive approach, knowing that she has osteopenia. And of course, there's risk factors. If you have a family history of osteoporosis, if you're more of a smaller frame, other risk factors like that maybe somebody might want to think, maybe I should get tested earlier.
Yes, that makes complete sense. And at university, we have the DEXA equipment, so we have at least the freedom of measurements for different studies. And sometimes we do it for younger population. And as you mentioned, also younger population might have osteopenia. It's not uncommon, and risk factors are important. So if we are small frame, and as you mentioned, if we have any history of osteoporosis, it's good to test and make sure that we have healthy bone.
Right. And you talked about people having a fracture and still not getting identified or treated for osteoporosis. And I think there's probably a little bit of that going on with my mom, but I'm trying to do the best I can as a dietitian daughter. She never was a big milk drinker, but again, with her mom having osteoporosis is potentially increasing her risk. And, I think that, again, going back to, we think of prunes for digestion, but we think of, calcium, vitamin D, dairy, which is important, but how so many people are completely unaware that something like prunes can help provide these important nutrients. So that's one of the reasons we're doing this podcast and why you're doing this important research. So let's talk about how the digestive health ties into this. Obviously, with prunes, you've been studying bone health, but what have you seen with regard to digestive health?
Sure. So I think the most obvious property of prune probably is digestive health, as you mentioned earlier, so that's what we expect. So we know for sure that prunes and prune juice, they contain fiber, and then they have sorbitol that is going to affect and contribute to our digestive health. There is a little bit research going on with the prune and microbiome, and hopefully, in soon future, we'll have some result and we would be able to share more about the digestive health. But anyone who has tried prune can really attest to the digestive health property of prune, I feel. But for our studies, we usually monitor our participants for their digestive health, kind of like trying to see if their bowel movement changed throughout the study, because one of the things is people are very afraid if they have a healthy condition, if they're not constipated, if they don't have any GI issue. When we put them on prune, really no rapid change happens in terms of their digestive health. And we want to show that in the research, because if bowel movement is increasing in the way that is not healthy, then that considered as a side effect. So we usually monitor participants. We have a 7-day questionnaires that we ask them to identify their bowel movements and, the quantity and everything. And it's like every 3 months we repeat that. So we have published the result of these surveys that we do with participants, and we have seen actually that prune is really not causing any unusual bowel movement for healthy digestive system. And it's just maintaining that healthy condition that they have, which is really good. And our older population, we haven't ever had any complaint about consuming prune. When I give talk at conferences, a lot of the time people ask me, so when you have 10 prunes, like nothing is like no rapid movement or no stomach pain or anything going to happen with prune, especially because it has sorbitol, and it has fiber. And we usually ask our participants to have their prune throughout the day. So it's usually don't have all the 10 at one time and spread it throughout the day. So it's just like having anything that's high in fiber, and that fiber is really good for us for maintaining our healthy digestive system. So as long as it's spread out throughout the day, and as long as we especially don't have it on empty stomach and things like that, snack it throughout the day, we are seeing great results.
Right. And we're not getting enough fiber. I believe adults in the United States are getting only about half of the recommended fiber. So this is another great way to boost that fiber. Up to 30% of children experience constipation. We know constipation affects pregnancies. It's funny because my son, I get some wonderful samples from Sunsweet, and he loves the amazing prunes and the diced prunes. He loves to snack on them. And I thought, wow, okay, you've had like 10. I think you better slow down and be careful. And the dietitian at Sunsweet reassured me, my kids do the same thing. And I think you're good with 10. But, as with any source of fiber, we do, recommend that you spread it throughout the day and that we get more fiber. So that's all good news. And I should say, with the samples that I get from Sunsweet, we've also made some really yummy recipes. There was this, I think it was called a bittersweet chocolate loaf cake. There's just a lot of things that you can do. And I'll put some tips and recipe links in my show notes at soundbitesrd.com for folks. And I might share some more specific ones before we wrap up. But yeah, there's a lot of things you can do instead of just snacking, which is great and delicious and easy, but incorporating them into recipes and using prunes to substitute for oil or sugar. and things like that in different recipes. So
that is true. And I always do the substitution for the prune and oil, and it works out perfectly in a lot of recipes. So that was a great suggestion. Yeah, I love that.
Right. So what else did you want to share about your research that I haven't asked about with regard to bone health, digestive health, maybe some recommendations for people with regard to getting their bone scans done and other suggestions?
Sure. I think we mostly covered everything, but definitely, as I also, talked about it earlier, it's important to know our bone density. And it doesn't matter young or old or whatever age we are, we always can be proactive about this and really do nutrition and like other life factor or lifestyle changes that affects our bone health. So it's important to have a higher bone density if we are, still reaching that peak bone mass. It's important to be able to maintain that bone density. And okay, if we are now hitting the age that we are starting to lose the bone, then we want to slow down that bone loss, so it doesn't matter what stage of our life we are at, we have responsibility toward our bone, and we can be healthier in terms of our bone health. In terms of research we didn't talk about, I think we covered everything. So what we have so far shown, is like you can go as low as 5 to 6 prunes per day. And I really think that's so feasible. Like I almost like 6 out of 7 days of the week incorporate that into my diet. And, it was a gradual, but you can add it to your salad. You can have prune juice, or you can have prune just as a snack, or like, as you mentioned, just incorporate it into different recipes. So 5 to 6, if just try it for a week, and it won't be really that bad. So it's something easy to add to your other nutrients that you're taking. But we know that study after study, it has shown that it's effective in terms of bone health. So why not adding that to our diet? And I think that's about it.
Well, I'm just thrilled that my son loves them. Anytime, you're a dietitian mom and your kid likes something healthy, you're just over the moon. So if an 11-year-old boy likes prunes, I think everybody would like them. And if people are interested in substituting prunes for oil, like I said, I'll have more details on my show notes, but you can make this prune puree, which is basically just blended up prunes. It's what we did when we made the bittersweet chocolate loaf cake. And so you would use 1/4 a cup of oil and 1/4 a cup of prune puree in place of 1/2 a cup of oil. And you can also substitute for butter. And just like adding the diced prunes to a salad or like a trail mix or something. It is very simple and it's very yummy. So I do encourage people to do that.
Perfect. One of my colleagues calls prune nature's candy. So I'm not surprised that your kids like it, because it's really kind of like candy. So
right. Yes. I mean, who doesn't want something sweet to snack on here and there? And like I said, we all need more fiber. So this is a great way to get more fiber. And also people are looking at the sugar intake in their diets and trying to limit added sugars. And of course, fruit. There's this big fear of fruit for some reason. It's such a nutrient-rich food, and, the fiber, the vitamins, the minerals, the antioxidants, and all these other wonderful, the magnesium, the potassium. We need more of that in our diets. Nobody can argue with that. So I don't want people to be afraid of fruit. But yes, no added sugar in fruits. 100% prune juice is no added sugar, and it does count towards your daily fruit and vegetable servings. So I like to promote all forms of fruits and vegetables. It doesn't have to be fresh. It doesn't have to be organic. We can use dried and juices and canned and frozen forms of fruits and vegetables to meet our daily goal.
That's true.
Well, thank you so much for coming on the show and sharing your research with us and talking to us about the importance of bone health and digestive health.
Thank you so much for having me on the show. It was a pleasure.
Yeah, I look forward to staying tuned to your research and seeing what comes down the pike.
Sounds good. Thank you so much.
And for everybody listening, as always, enjoy your food with health in mind. Till next time.
For more information, visit soundbitesrd.com. Music by Dave Burke.